Well, hi, everybody. Welcome back to Habitual Excellence. I'm Mark Graben from Value Capture. And we're joined today, our guest is Dr. David Zaas. He is the Chief Executive Officer for the MUSC Health Charleston Division, and he's the Chief Clinical Officer for MUSC Health. He's a pulmonary and critical care medicine physician with an interest in advanced lung diseases and lung transplantation. Dr. Zaas's research interests have focused on improving outcomes from lung transplantation, including the role of infectious complication and organ rejection. He's also actively engaged in the education of students and graduate trainees, as well as being a leader in hospital administration. So before I tell you a little bit more about his background, Dave, thanks for being a guest on the podcast. How are you?
I'm doing great, Mark. Thank you for having me, and I'm really excited to be here.
Yeah, well, it's a great opportunity to hear your thoughts and to learn from you today. So before jumping into that, let me share a little bit more about Dr. Zaas's background. He graduated from Yale University in 1994. He completed his medical degree at Northwestern University in 1998 and did his internship and residency at Johns Hopkins Hospital. He completed his fellowship training at Duke in pulmonary and critical care medicine in 2005, formerly serving then as medical director for lung transplantation at Duke. And then he joined the MUSC faculty in 2020 and is professor of medicine again at MUSC. So, we're going to talk a lot today about lean management systems, something you've been involved in, for a while. If some of us would frame lean management systems as a solution, maybe we can first talk about some of the problem statements that might make a lean management system necessary and helpful. How would you define the problem statement? Like, what are the biggest pain points that you see and have seen?
No, thank you, Mark. I think all of us in healthcare and all of us that have been committed to the quality and safety and high reliability journey consider us students of lean, right? We're constantly learning.
Yeah.
And I think the question of the problem statement for me has really evolved over the last several years. And it really started with that commitment to zero harm, the commitment to our people, to building our teams, and honestly being frustrated that we weren't achieving the sustainable excellence that I knew we were capable of. And over time, as I've matured in my learnings, I realized that, the problem statement to your question that we're trying to solve is how do we best support our people? Mm-hmm. How do we ensure that all of our amazing team members in healthcare have the ability to thrive in that role that they serve? And what is our role as leaders to support them? So that's really the passion and problem statement that motivates me.
Yeah. How has that problem statement changed or evolved in the last couple of years with COVID and all of the different pressures for patient care, pressures on care providers?
So I think it's become even more of a burning platform. It's become more important for all of us to understand, right? Throughout the pandemic, we quickly had to go from just a mindset of emergency management. And we got really good at emergency management. But we realized, right, this wasn't a 24 to 48 hour emergency. This wasn't a 30-day emergency, right? We're now 2 years in, and we realized that the importance of building process, building teams, the importance of resilience and grit is by far the most important thing we do as leaders. And not just putting out the fires, which we got really good at.
Yeah.
But really doubling down on that commitment and really as leaders staying above the moment-to-moment crisis to really help support our teams with what they've needed. So it's been a leadership challenge that I think all of us in healthcare would have said we would have never imagined.
Yeah. So that phrase, staying above it is interesting. I mean, in a lot of organizations, a lot of leaders would sort of dive down or swoop in or, rush to where the proverbial fire or the real emergency is. I'm curious, from your standpoint, how do you find the balance between empowering and delegating people at the front lines, without being completely disconnected, without swooping in to solve it for them? Like, how do you find that balance?
So it's a tough question, and I think we've all learned and hopefully matured over the last 2 years.
Yeah,
I think I would recognize myself that we probably made mistakes in the beginning as leaders, that we did jump in and try to solve problems and help our teams, but then needed to reflect that, right, those problems are going to be best solved locally. And we have amazing, compassionate, dedicated care team members that we need to not only empower, support, get out of the way at times, and remove barriers when needed.
Right.
And the scope of the problem and the challenges were so broad and great that we quickly learned that, right, accessibility, communication, removing barriers were absolutely critical. But our teams were coming up with markedly better solutions than our leaders ever could have as individuals. And the cycle time, the pace of change and improvement is something I've never seen in over 20 years of leadership, of teams on the dime being able to adjust to new protocols, new policies, stand up new services, connect outside of our hospital walls. So, right, our command center and our leadership engagement was absolutely critical. But most so to be coaches, right? To be coaching our teams, to demonstrating our values and principles, and also empowering them that we had total trust in their ability to really save lives across South Carolina.
Yeah. Well, and you talk about being compassionate. We can be, compassionate about mistakes, and that includes, as you said, I think, leadership mistakes. The key, I guess, is practicing what we preach about: continuous improvement, right? Recognizing the mistake, reflecting, addressing it, and instead of just continuing to repeat the mistake if and when it's recognized. Could you share a little bit more about maybe that reflection and improvement process around that mistake as you described it?
Yeah, I think it's important for all of us to have that humility and that structured reflection as part of our leader standard work and part of our team standard work, which we've started to develop. I transitioned to MUSC in June of 20 as the pandemic was really just starting. And I think the tendency of all leaders, myself included, as a new leader in an organization sometimes is to come in and take action, especially in the setting of a crisis.
Right.
And when you don't know the team members. But it was an amazing opportunity to quickly reflect that we weren't going to be successful unless I could really ensure that my goal was to make every member of our team better, that I would empower them, give them a seat at the table, to create their voice and allow them with the ability to innovate like they never have before. And it was exhausting and the hours were long for all of them. But I said there has never been a time that I've been more proud of that team and a leader. And sometimes people reflect and say, well, you picked an interesting time to move organizations. And I said, it's an honor and a privilege to get a chance to lead an organization at any time, but especially in a time over the last 2 years throughout the pandemic. And I would hope, I know can speak for myself, that right, it's been very humbling and inspiring to be able to watch the excellence. We talk a lot about our mission of improving the health of South Carolina and beyond.
Yeah.
And when I speak with our team members, I say, we've always been a very mission-focused organization. In the last 2 years, we have made more progress toward that mission than any time in our 200-year history. because of what our team members have done. And that, I think, is important to reflect on when you're tired, when you're short-staffed, when life is hard, to really reflect on the impact that the team has had.
So that sounds like an answer to the question of how do you build resilience and grit? It sounds like what I hear you saying is reminding, bringing it back to purpose.
So I think it's, maybe I'll start with 2 or 3 components, Mark. How do we develop trust in our teams and in our community? And I think that trust is absolutely critical to developing resilience and grit. I think our team members need to have trust in the organization, in our leadership, and at times of stress, which we've lived through, that trust becomes even more important. But my hypothesis is, right, those organizations and leadership teams that can develop trust in their teams, trust in their patients and their community, right, will achieve excellence. They will. You can demonstrate resilience. You can develop grit. And it's important, right, if you break down the components of trust, to think about the importance of not only, right, the competency and skill of our team, but maybe more importantly, right, getting back to our values and thinking about integrity and compassion, and how we demonstrate that to all of our team members. So, right, we doubled down on leadership availability, visibility, communication, openness, every day. And we were really learning things every day. And I think what led to our success, and the success of a lot of organizations around the country, right, was that ability to, again, foundationally develop trust within your care teams in order to build their resilience. And the reason I link those two together is it's right, the resilience is our obligation as employers. It's our obligation as leaders to give our teams the ability to develop that. Yeah.
No, I mean, I think those connections make a lot of sense. It seems like if people aren't feeling that trust, if they don't trust their leaders, they're not going to speak up about problems. They're not going to ask for help. They're not going to share concerns, and then that could then maybe lead to to burnout. So I think so I'm curious, before asking another question, I'm curious to hear your thoughts or reactions to that idea. What happens if the trust is not there?
I think it leads to burnout and turnover, and it impacts patient safety and quality and all of our outcomes.
Yeah.
And we try to connect it back again to our principles, right? The trust comes foundationally right back to respect for people, and how we lean on those principles and demonstrate that every day as coaches for these teams. And one thing to highlight, MUSC, we're still early in our journey, right? We're still building our improved 2.0 management system. And when we were early in the pandemic, we really accelerated our lean management journey. And some people questioned and said, we can't add additional work to our care team members. Right? They're trying to survive. We can't ask them to start doing something else. But we foundationally believed that actually trying to advance our lean journey at the same time as we were during the pandemic. I wish we would have been further along in our journey. I think we would have been more prepared. But it was really vital, I think, to our success to really advance our lean journey at the same time that we were putting out fires and dealing with the immediate crisis, because it brought us back to principles, behaviors, process, communication every day.
Yeah. Well, that's great to hear. Leaning into it, during the pandemic, as opposed to pulling back from the structures and the methods of a lean management system. But you focused I love hearing you talk about principles. Like principles should remain completely solid and consistent regardless of the day or the week or the crisis or a new normal. I mean, it seems like what I hear you saying is holding to principles builds trust. I've heard people describe more simply, you build trust by doing what you said you were going to do. Like, all right, well, then maybe that's one layer of it. But then it seems like, showing that these principles don't bend in challenging times builds trust and all sorts of positive connections to your care team.
I think you're right. And I think it's important. And I think it's important to say it's more than just doing what you said. It's your intent and your values. Mm-hmm. And I really believe that our team members can feel it. Yeah. And we have to demonstrate it. And there's no doubt over the last 2 years, we've had to reflect and pull ourselves back to principles and behaviors, right? We all have this natural tendency to get caught up in the tools and caught up in actions. And our team, and I'll credit my leadership team, has done a good job of pulling me back at times and saying, all right, let's go back to our principles and make sure that we are following those as we move forward. Mm-hmm. And right, as leaders, with the crisis around us, how do we role model the compassion, the calm, the integrity to support those teams and not jump into the moment?
Yeah. So I want to ask you a little bit more about how you define a lean management system. But first off, can you give a little bit more context? You say you're early in the lean journey. What was some of the time frame? Give us a little bit of maybe the high level history there at MUSC.
Yeah. So again, several years prior to my arrival, the commitment to quality and safety from the MUSC team really, I think, started this journey, and we built the improved management system, our quality coaches, and we had a commitment to our values and mission as an organization that I think goes very deep. And in all honesty, really was what attracted me to take a career move and a leap due to the commitment to values and mission of the state organization here in South Carolina. Mm-hmm. At the same point, we hadn't hardwired those behaviors, principles, or all of the lean management tools. We recognized in the first few weeks I was here that, we didn't have robust tiered huddles. We didn't have a clear help chain. We hadn't fully implemented A3 problem solving across the organization. And that was when we realized that more important than ever, right, those basic tools were going to be critical for our success. And we were fortunate enough to recognize early this was not going to be short-lived. And so our planning and our structure design was, we need to build the long-term management system, because this is no longer just an event or a crisis. This is going to be how we're going forward. And the hypothesis that if we build this now, it's going to benefit our operations, our organization, the excellent care we provide, right, for decades to come by building it. And we're going to have an urgency now to build it more quickly because of everything going on around us. And our leaders, to their credit, really embraced it. And we didn't give it a big brand or a logo or a communications platform. It was, this is how we're going to lead, and the tools and resources to support our teams, and build that without some of the typical launch of a new initiative, but really built those behaviors, principles, lean process that have helped us.
So then remind us the exact phrase you used. Was it management system 2.0 or what? It was something like that. You do use some language there, right?
I did.
Or is that just you informally?
No, We used it amongst our leadership team, although there was two things that helped our decisions. One of which is we had embraced the improved management system previously. Our team members were familiar with it. It was the foundation that really led to a lot of our safety and quality improvements over the prior years. So rather than adding something new, we wanted to build on that foundation, but really hardwire the behaviors and principles and some foundational lean tools. So we called it Improve 2.0.
Okay.
Because we weren't pivoting. We weren't going in a different direction. We were building on the foundation that the team had built, but we realized we needed to focus on those principles more, and we needed to make sure that the tools were widespread, and we had them developed in leaders and teams. But the core that drives me in this journey, right, is that ability of empowering our teams as problem solvers every day, not just in the pandemic, but every opportunity they have, and developing our leaders as coaches and really pushing that down. So we quickly redesigned daily safety huddles. We quickly redesigned tiered huddle structures. We quickly redesigned help chains and problem solvings because we needed every care team member, not just our quality safety team, to really be the problem solvers across the organization. And I'll highlight our facilities team. We talk so much around our clinical care team members that have just been outstanding. But we forget that every member of our organization was impacted. Our EVS, our facilities, the examples of innovation, of how they do their job in the setting of the pandemic and the challenges were just heroic.
Yeah. It's great to recognize all of that. And, when you talk about doing a 2.0, you're recognizing that whatever happened before wasn't all bad. We're going to make it better, which that seems like part of the mindset right there of whether we call it continuous improvement or lean or whatever label or phrase we give to it. So that's great to hear. Continuously improving the way you're improving care, or the way you're improving processes. That's the way it should be, it seems.
Yep. And I think we still have a long way to go. I think we recognize, right, we need to get to 3.0, 4.0, 5.0 over the next few years. And that's not just from our team development. That's from my development as a leader, as well as our team, of how we continue in that journey and how we learn together.
Yeah. So let's dig a little bit more into some of the components or the practices or the tools, if you will, within the lean management system. You've mentioned a couple already, and we've talked to some other guests previously on the podcast about things like daily tiered huddles and A3 problem solving and help chains. I'd like to hear a little bit more from you about the help chain and how that works. But are there other major components within the lean management system that you haven't brought up yet?
So I'm sure there is, but I'm trying to think around what's best for your audience, Mark, here as we're trying to focus on this. What I would highlight really is the focus in each of our areas is truly our people. And I foundationally believe that we are building these tools to support our people, and that we have amazing team members. And if we give them the skills, if we lead by example, right, the outstanding results follow.
Yeah.
And I'll use an example maybe through our evolution of safety huddles. And again, we had a commitment of 5 days a week leadership engagement in safety huddles, but it was leaders going to the front line to solve their problems. It was leaders receiving a list of problems from team members to go fix.
Yeah.
And we've evolved it to really empower those team members to not only recognize the great work that they're doing and their team members, to share their successes and where they've hit barriers. And I look over the journey of the pandemic, and despite the staffing challenges and stress, the engagement, the feedback, the enthusiasm, the cultural change within the organization. When I look at my experience at Duke and some great teachers and mentors on my own lean journey and here, the most profound impact I see that maybe we don't talk about enough is the impact on culture.
Mm-hmm.
Right? We talk about we can reduce harms 50%. We talk about eliminating waste and the financial impact. For me, what's most exciting is the impact on our people and how we create culture through building these tools. And I hope all of us that are listening and all of our leaders believe, right, that if you really create a healthy culture that really gives everyone the opportunity to thrive, and being intentional in that word, that everyone needs the opportunity to thrive. And how do we use our lean tools to create culture is the critical success factor.
I mean, it seems like it all goes hand in hand where, let's say, focusing on people is a mindset and a principle. And then there are behaviors that come out of that. It seems like there's a lot of, yin and yang or chicken and egg here where you don't just snap your fingers and change the culture. You've got to do some things and practice and be coached and improve. And that starts becoming the culture. It seems like focusing on developing the culture then leads to improvements in other outcomes, right? We have a better culture, which includes people being engaged, workforce and people hopefully being happier, which means they're participating in improvements, and that drives better outcomes then as a result, and probably then leads to people wanting to stay, reducing turnover. We've heard so many stories about that. I mean, it seems like they're become virtuous cycles, if you will. These connections between tools, culture, principles. It seems interconnected the way you talk about it and the way I've seen from others.
I think it is, and I think it'd be an interesting reflection to say, does that help determine the long-term success and sustainability? Mm-hmm. I think we can easily learn the tools and the techniques. Mm-hmm. What will allow them to sustain them, to be embraced, and to really drive, sustained excellence is that importance of the focus on the, again, principles, behaviors, culture that we create. Mm-hmm. And I think sometimes we forget that. I think in all of our journey, I think sometimes mm-hmm. we focus on the shiny objects. We focus on the tools. And I love the tools, but realizing the impact, and I reflect on where we are as a team now compared to 2 years ago, and I can feel the difference. You can hear the language. You mm-hmm. can of how team members and leaders are thinking and processing, and we're really early. Again, we're nowhere near where we need to be. Mm-hmm. But what excites me and what I'm proud of is to hear and feel the difference of how we approach those challenges every day that we see, and that we really embrace it. One of my favorite coaches, who well, taught me something early in my journey about, finding these problems in others are treasures. Mm-hmm. And I laughed a lot when I treasures, because I was like, I got a whole treasure chest. But that's creating the culture of leaders and teams, right? The ability to see problems as treasures and embracing mm-hmm. the opportunity to solve it together, and that pride and working on it together. Mm-hmm. That's more important than what the visual management board looks like mm-hmm. and how neat their huddles are, and others in terms of driving the impact.
It's very well said. I wanted to, of all the different things I could ask you, let me go back to the help chain thing for a minute. Can you talk a little bit about how that works within the context of the tiered huddles, and what information does flow upward? What calls for help do flow upward or should flow upward within your context?
a lot that I can share there. Again, as I said, our tiered huddle structure didn't exist. We sort of were missing the lowest level, and we were missing the highest level as we started. And we're a new health system. We're rapidly growing, and we've integrated 8 community hospitals. So we, at the same time as we were doing this, had to realize we needed to bring into our help chain and our tiered huddles, right? Not just our 4 hospitals in Charleston, but our 8 other hospitals around the state of South Carolina. So the first component that we built was really, again, standardizing how those frontline teams huddled, but at the same time, senior leadership committed that, right, we were huddling daily, focused around safety, senior leaders from across the system, and really then, so what do we need to know to have each of those be able to be appropriately as cascaded? And I think it's important that for us, we've really emphasized that cascade is bidirectional, right? And especially during the pandemic, right? Our tiered huddles were not only valuable for me as a leader to understand, needs, barriers, problems, challenges, but huddles were equally important for us to cascade the dynamic information that was changing every day.
Right.
And we need to live those values and behaviors from our teams, right? That we were present, but we were also now having to do this virtually, and trying to build tiered huddles and lean management systems in person in my prior life, and now trying to do it virtually are very, very different challenges. And we had to be innovative and creative of how to do it. We also, as part of, we've got a longstanding commitment to just culture and focus and our teams here. One thing that we quickly realized, and I think this plagues healthcare in general, is sometimes raising the help chain is viewed as a sign of weakness. And there's a perception from team members that, trying to fix it on their own. And we had to go through a few iterations and are still, I think, on this journey of how do we really create a culture that using the help chain is not a sign of weakness. It's a critical safety element.
Right.
So team members are aware of challenges, that impact others, and how we really map that out. But we're all high achievers. Our team members don't want to disappoint us.
Sure.
And we had to address, as I think many organizations have, that you can map out the help chain, but if you don't change the culture about why we're using the help chain, that it's not a sign of weakness. That it's a part of teamwork. And again, going back to our values and behaviors, right? That living that was absolutely essential. And I think, right, we had to go back and we realized, right, why are we not hearing things through our tiered huddles and help chain? And it wasn't that our team members didn't care or weren't working on everything we were doing. It was really having that cultural impact of why the help chain is so important and why we want to rely on our tiered huddles to support them and the outstanding patient care they deliver. Yeah.
So Dave, maybe one final topic here, kind of thinking about the intersection of goals and principles in a couple really important areas. So first off, you mentioned earlier, zero harm as a goal. Focusing on the methods and the culture that would help you get there for the benefit of patients, and for staff. I'm glad you mentioned just culture, because that's, an important piece of it there of, showing respect and not blaming people for systemic problems. So I wanted to ask you maybe to elaborate a little bit on using that goal of zero harm in a way that's inspiring, because, there's a common pushback. People will say, well, that's a journey, or zero is not possible, or it's discouraging. They said we're going to get to zero and we haven't gotten there yet. Like, how do you make that kind of a positive aspiration that keeps people working at it?
Yeah, so it's a great question that has come up as we really started this journey. But I think it's important to strive for those, infinite goals that we will never achieve.
Mhm.
And we talk a lot about striving for perfect patient care. While we will never achieve perfection, right? Why would we ever aim or try for something less?
Right.
If we were the patient or the family member, right, why would we ever strive for anything less than zero harm?
Mhm.
If we think around the workplace injuries and workplace violence that's really increased post the pandemic,
Mhm.
right? We need to strive for zero harm and perfect patient care every day. And I think it gets to that importance of building trust with your care team members,
Mhm. Mhm.
explaining why striving for those goals that are always just out of reach is what our patients, families, and our team members would expect every day. And how do we make that inspiration? That's not disappointing when we don't get there, right? But we're getting closer every day,
Mhm.
and we're going to learn from every time we come up short. And if our goal and our commitment to the residents of South Carolina and to all of our team members, then that needs to be that aspirational goal. So I try to incorporate it into my language and my newsletters. We define harm very broadly, right? Harm isn't just our hospital-acquired infections, right? Harm, each one of us in every of our areas can identify, right, what are those harms that we want to eliminate?
Mhm.
Whether it's a hospital bloodstream infection, whether it's too long of a wait for an appointment, whether it's sending you the wrong bill, whether it's an employee, right, that gets the wrong paycheck because we don't have our internal processes correct, right? Every day, striving for perfect patient care, striving for zero harm. I think if we, again, go back to our principles and our behaviors to our teams, is really inspirational to me. But I think it's, again, we need to be storytellers. And we've had to be storytellers probably more during the last 2 years than we ever had through our leadership career. And I think this is an important part of the story. I worry when people say that zero harm and perfect patient care aren't inspirational. Then we really need to be thinking differently and focusing on telling our stories of why there is nothing more inspirational than perfect patient care.
Yeah. Yeah. And I agree. To me, it's inspiring. And I think it comes back to the issues you've raised already around culture and trust. In one organization, leaders might throw the phrase zero harm around, but staff feel like, well, you're blaming us, you're punishing us, instead of working together to create the conditions and the processes and the mistake proofing and all the things that we would do to significantly reduce errors that lead to harm, and making it psychologically safe for people to speak up about risks and near misses so that we can fix things and get closer to zero harm.
Yeah. And more important than ever, I mean, I think zero harm to each other, to our own care team members, is more important now than any time in my career, both from what they went through during the pandemic and threats to their own health and safety of their family, to the workplace violence that we see today. So I think the zero harm commitment for us, again, is both to our people and to our patients. And in many ways, focusing on zero harm to each other is absolutely foundational.
Yeah. Yeah. And so then the final goal and value that I wanted to ask you about, when you talk about staff, you talk about harm, and there's a focus on preventing physical harm, of course, but then, different types of, I don't know if you will, emotional harm or mistreatment or inequity. Yeah. How do you incorporate goals and values when it comes to diversity and inclusion in terms of, as Paul O'Neill always stated it, making sure everyone's treated with dignity and respect in every interaction with every person every day? How do you define that
So that's an exceptionally important question over the last 2 years when we look at the impact of not only the pandemic and health equity and health disparities for vulnerable populations.
Right.
After many of the murders of George Floyd and others, and the systemic racism that we've seen in our society, that commitment to our values and behaviors and principles applies equally well, or maybe even more importantly, to how we handle diversity, equity, inclusion. And it's important in every health system. And it's clearly very important here in South Carolina with a lot of our history and challenges in the past.
Right.
Part of that, I'll go back to earlier, is focusing on our humility. I know after the murder of George Floyd was soon after my arrival, and that humility, that ability to listen and learn, to understand the pain and the impact on our community, to see the challenges that we've had over the last 2 years, and as leaders to show our commitment to realizing that we are, as we strive for perfect patient care, right, we're also striving for health equity. We're also striving for, as I mentioned earlier, that ability to have an opportunity for everyone to thrive.
Right.
The only way that everyone can thrive in our community, right, is really embracing our diversity. The only way that our team can really achieve excellent, sustainable results is through valuing our differences and our perspectives and ensure that we are high-performing teams and able to create that sense of inclusion. I think it's been a really hard 2 years for our team members, not just from COVID, but from the challenges in the world around them. But for leaders, and I will speak for myself and our team, it's important that we put those issues on the table, that we have those discussions, and that we really learn from our team members. And we still have a long way to go. I mentioned earlier, we're early in our lean journey. Right? We have a long way to go in our journey towards health equity and true diversity and inclusion and elimination of racism. But that commitment to achieve that goal and the humility to embrace it and to embrace our shortcomings, but to strive for perfection.
Right. Well, thank you for aiming for as you called it infinite levels of performance, whether that's 100% or 0. Paul O'Neill would use the phrase theoretical limits as aspirational, inspirational goal backed up by the culture and the mindsets and the behaviors that you've told us about here today, Dave. So thank you for all of that, for focusing on all those important challenges. Thank you for bringing up health equity from a patient perspective and a community perspective as well. Thank you for connecting the dots on all of that.
No, thank you for the opportunity, and I really enjoyed the conversation. So I appreciate it, Mark, and appreciate all that you do.
Well, thank you, and thank you for sharing everything that you did today, and I know it's going to be really helpful for the people listening. So again, our guest today has been Dr. David Zaas. He's the CEO for the MUSC Health Charleston Division, and he's Chief Clinical Officer for MUSC Health. Again, thank you so much, and look forward to talking to you again sometime. Keep it up with the journey. Yeah.
Thank you, Mark.